Hey there. Today I have a special guest, Dr. Gurdeep Parhar, who's the medical director at the Adult ADHD Center, based out of Vancouver, but have a lot of offices across Canada, Vancouver, British Columbia. And he's joining us today to discuss ADHD medication and myths. Dr. Gurdeep, thank you for joining us today.
Great. Thank you, Andre. Thanks for having me on the program.
You want to just give us a quick background of the Adult ADHD Center and what your mission is? Because I'm really we're very fortunate to have an organization like yourself with this specific mission in Canada.
Thanks, Andre. So about 6 or 7 years ago, we realized that there were not a lot of services available for adults with ADHD. With children, most pediatricians and psychologists and school people were able to help with that. But with adults, there were not a lot of places to turn. So when I had my first patient in my family practice with ADHD and realized there wasn't many resources for him, then we got to thinking that there's probably many people like him. And so ultimately, what we did was we set up an adult ADHD center for doing assessments. And we have practitioners across the country in every province and every territory where we do ADHD assessments and we provide recommendations. Once the diagnosis is clarified, we offer recommendations for treatment of the ADHD, both medication and non-medication treatment options. And then that lets the person move ahead with what they need to do for the management of their ADHD, or if they need to pursue some programs like government grants or disability tax credits. So let's them move on to the next stage once they know that they have ADHD.
Well, fantastic. And the other thing too is I really like about your program is it's actually a very affordable service. We're not talking in the multi thousands of dollars here like a lot of. So I really commend you and your organization for finding that shortcut for adults. You can get more information at the adult, sorry, not the, it's adultadhdcenter.com. And that's the Canadian spelling of center. So CENTRE. I will have that link in the show notes so it'll make it easier for everyone. Um, so we want to talk about ADHD medication and myths. Did you want to give us a quick rundown and kind of give us the scope on the different types of medication and how they work?
That's a great question, Andre. And I think there's a lot of sort of misunderstandings about the medications. And actually, the understanding the medications of for ADHD is pretty straightforward, mostly because for good news and bad news is that there aren't a lot of medication choices. So the medications sort of fall into what we call first line treatments, which means first choice. So if somebody has ADHD, the nurse practitioner or the family physician or the psychiatrist, the pediatrician has a group of medications that are considered first line or first choice. And there's five of them. And those are the ones that the Canadian clinical practice guidelines on ADHD have determined these are the ones that people should start with. They have the fewest side effects, they control the symptoms really well. And that's what we call first line sort of treatments. And those are stimulant or psychostimulant medications. And then there's second line, which are non-stimulant medications. And the choices are even fewer in that group. But with this psychostimulant medications, the general goal is that we want to make life easy for people with ADHD or easier. And what that means is that the medication should be once a day dosing. So you take it once in the morning. It should last for the bulk of your day, whether you're going to school or work or have hobbies, whatever your day entails. So the medication's working while you're working. And then the medication peters off towards the end of the day when you want to just chill and go to sleep. So what we don't do like old times, and for those of you that are as old as me, you'll remember in the 70s, the medications like Ritalin or Dexedrine, they had to be taken 3, 4, 5 times a day because the medications only lasted 2 or 3 hours. So
Mm.
if you can imagine, if little Johnny or little Jane had to go to school, you'd give them medication once they left the house at 7:30 or 8 in the morning. Then around 12 o'clock, their ADHD would be acting up again because the medication worn off. Then they have to take it again at 3 and then maybe again in the evening. So we're avoiding all that. So the first line treatments are once a day dosing of ADHD medication. Psychostimulant medications are the first choice. And long acting. So what we want to do is have the medications last as long as they can. So as I said, there's two big families. There's the first line medications, which are psychostimulants, and there's the second line medications, which are non-psychostimulants. So in the stimulants, that group is divided again into two sort of subgroups. I mentioned the word Ritalin. The medical word for Ritalin is methylphenidate. And in that family, there's actually three types. So we don't use Ritalin anymore, exactly for the reason that I said, is it's too short acting. It sort of spikes in its effect, and then there's a crash 2 or 3 hours later. So if you were to take Ritalin, you'd have to take it again and again over the course of a day. So we don't use Ritalin, but what the pharmaceutical companies have done is that they took the Ritalin and they actually reformulated it or repackaged it into capsules so that it lasts a longer part of the day. And so now in the group under Ritalin, there's Foquest, there's Concerta, and there's Bifenton. Your listeners may be familiar with those three names. And really, the important thing to remember is that with Foquest, Concerta, and Bifenton, it's the same molecule. The medication is still Ritalin. It's just the delivery system is different because it's put into a capsule, and there's a certain percentage of the medication that is active right away. And then there's the rest of it that's sort of spread over the rest of your day so that it gives you the full coverage. But really, all three of those medications, Bifenton, Concerta, and Foquest, are basically Ritalin, each with a different delivery system.
So it's the same medication formula, except it just gets released slower in your system throughout the day by the way
Exactly.
it's capsulated.
Exactly.
Oh,
And,
cool.
each one of those three, the Bifenton, Concerta, and Foquest, it has a delivery system that's just a little bit different. So for example, with Bifenton, there's a bigger percentage of that medication when you take it in the morning that sort of gives you this sort of kick and boost so you can get your day going. And then the rest of it is sort of has its effect over the day. Whereas Foquest, which is made by the same company, it has a little less percentage that gets released right away, but then it lasts for longer a lot longer over the day. So really then what we can do is start to tailor the medications for what somebody wants. For if somebody who really needs a big boost in the morning just to get their morning going, they might be better off with Bifenton. But then the trade-off is the medication won't last as long into the
Right.
evening. Then there's other people like nurses and stockbrokers and other people that have really, really long work days. They say, no, 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 the morning is important, but I'd rather have as much coverage over the day. And for that reason, Foquest would be a good choice for them. Concerta somewhere in the middle, where it has some coverage. But remember, all three are still Ritalin or methylphenidate.
Right. And what about the second line choice that you were talking about, the non-stimulants? What's the
Yeah,
big difference between stimulants and non-stimulants,
sure. And
besides the
Andrew,
fact it's not a stimulant?
yes, yes. Andrew, even before we get to
Yeah,
that,
go ahead.
the other group of the first line ones,
Ah, right.
so the Ritalin was one group,
Yeah.
and the other group is the amphetamine group.
Mhm.
And these are still first line, so you can choose amongst these ones just the same as you could with the Ritalin ones. The base medicine here is amphetamine or dexedrine, but here it's a little bit different. The two medications are Vyvanse and Adderall XR,
Mhm.
not to be confused with Adderall immediate release, which some people see as a party drug. Adderall XR is once a day dosing and isn't the party drug that sometimes gets seen on movies and other
Right.
things. So the Adderall XR and the Vyvanse are amphetamines. They're not the same molecule. They're different molecules. You take it in the morning and it lasts over the course of a day. And they're both fairly good medications as well. So they're the other group. So,
Okay.
so to summarize, in the first line choices, there's three that are Ritalin based and two that are amphetamine or dexedrine based. So there's five of them that are first line. But to answer your question, when we go to the second line agents, there's really two medications that are generally known. One's atomoxetine or
Mhm.
Strattera, and the other one is guanfacine or Intuniv. Now, for adults, and this gets confusing sometimes, only the Strattera or the atomoxetine has actually been approved by Health Canada for patients over the age of 17. So that doesn't mean we haven't seen adults taking guanfacine or Intuniv, but really, Health Canada hasn't approved it. So another way to say that really at the end of the day, we have only one non-stimulant choice for adults, and that's Strattera Strattera or atomoxetine. Now, it's a slightly different medication. When you think about the stimulants, as you said, that the stimulant medication has more of a, I call it a boom effect. Once you take it, it immediately works. If you're on the right
Right.
dosage, a day of taking it versus a day of not is a huge difference. The atomoxetine Strattera is quite a bit more of a gentler medication. That doesn't mean it doesn't work. We have many patients where it's worked very well, but it doesn't have that same sort of dramatic effect. Why would we use the non-stimulant? Is mostly for people who can't tolerate tolerate a stimulant. So stimulant medications, when you think of stimulant medications or any side effects they might have, think about too much of any stimulant like coffee or an energy drink like Red Bull. Right.
Mhm.
And so there are some people who are really sensitive to coffee or an energy drink. Then there's other people who aren't that sensitive to it. So if somebody's really, really sensitive to stimulants and side effects such as palpitations or increased anxiety, irritability, palpitations, if that really bothers them, and we've tried a couple of the first line medications, those five that I mentioned, then the only alternative is to go to the non-stimulant like the Strattera.
The other thing too with the non-stimulants is there's some jobs that are regulated. They're not allowed to have designated substance. So like I lost my pilot's license actually when I got diagnosed with ADHD, but it's actually because I lost my medical because I was prescribed stimulants, which is a controlled substance. Therefore, I automatically lost my. So pilots, the atomoxetine route is the better route because now legally they can fly again because they're on using a non-stimulant. So sometimes there's that difference too, depending on the job and the regulations around it.
Yeah, that's a really good point. And I could talk to you about hours for hours on how I think that's unfair. I know,
Yeah,
and I always say, would you want your pilot to pretend they don't have ADHD because they want to keep their license, or would you want your pilot
yeah,
to have their ADHD well controlled? So I think most of us would want our pilot's ADHD
yeah.
well controlled, right?
So basically, what I heard was the stimulants is almost it's an immediate reaction or effect, while the non-stimulants takes time. You need to build up your system to start seeing effects.
Yeah, I think exactly. And it depends on the dosage, but with the stimulant medications, there tends to be a much more immediate effect when you take the medication, whereas the stimulants, it doesn't mean it doesn't work immediately. It's just a bit more of a gentler
Right.
delivery system. Yeah.
Okay. Um, so we all know, like the listeners, I've been talking a lot about to the listeners too, is that ADHD is a multimodal treatment plan, which includes medication, education, and behavioral skills training. Um, and what I want, do you have anything to say about how important that medication is to the treatment plan, but is not the only solution? Is that a valid statement?
Brilliant. And that's exactly our philosophy as well. If life was so simple that you could just take a pill and all your problems would go away, I think there'd be too many easy solutions like that
Yeah.
out there. Um, but what we found is that the people that do the best with their ADHD really take a multimodal or holistic approach. And as you said, it's about education, learning your condition. It's about the behavioral stuff. It's putting in systems around you, using schedules and routines, working in exercise, meditation, and regular
Mhm.
diet, going to professionals like coaches and counselors who can teach you things that you aren't able to find solutions to on your own. So, for example, coaches can help you put in systems in place and help you succeed. Counselors can help you with things like self-esteem and self-confidence and relationships. But what we always say is that if you have tried all the non-medication approaches, and you haven't gotten to the level of functioning that you need, that's when you really should be thinking about the medication. But if you can, with the non-medication approaches, get your self up to a level of functioning that's quite satisfactory for what you need to do in your life, then you don't need to worry about the medication, right? So the medication helps, and for people that take it, it's life-changing, but that doesn't mean everyone needs it. And we always encourage people to explore the non-medication approaches first, and definitely not abandon them, even if they do go on medication. They need to be used together.
I'm really love that you said that because like for me, it's one of those like, and I just want to make sure the listeners understand here. These are all opinions and what we feel based on our experiences. And I don't want to impose anyone to make a judgment or not based on what we're recommending here. It's a personal decision if you want to do medication or not. And there's a lot of various reasons. Like I'm not on medication. That was a personal choice not to do it. But at the time when I was on medication, it actually was very helpful because it actually slowed the world down so I can catch up until, and like you said here, when you can't get to your level of functioning, the medication would be part of the solution. And I really love that phrase. And I could never articulate it until you mentioned it. Um,
The other part of that, Andre, is people sometimes ask me, well, if I go on this medicine, am I going to need to take it for the rest of my life? And my response to that is, I don't know. It depends on what's going on with the rest of your life, right? So if right
yeah.
now life is demanding because you're in school or you've got a new job or you've got demands at home with the kids, you might want to be on it. Then life might turn around the next corner and get a little bit easier. And if it gets easier for you because you put those systems in place or life's just easier, you might not need the medication. So that's the other thing about this is it's a journey, right? And
Yeah.
I can't
Yeah.
predict if you're going to need the medications for life because I can't predict how demanding your life is going to be for you, right?
And I think that's a massive myth. I think you just helped clarify is, lifelong use of the medication, yes or no? And I love that answer. It depends. Because I do think at times, I know a lot of other successful entrepreneurs, they don't use their medication regularly, but at times when things get tough or all of a sudden it's not working well, they'll go back on medication short term so they can get things into order. And I really like that. It depends. And I think you're right. With my weight, I'm going back to the gym again to get that push because the way I was doing it before, I was gaining weight. So it depends. Now I'm doing a different thing. So I love that answer. So thank you very much on that. Now, the other thing too is what about sleep?
That's an excellent question. So when we think about stimulant medications, the general understanding is, well, if it's a stimulant like coffee or an energy drink, of course it's going to interfere with sleep. It's much more complicated than that. What we found, what's interesting, when we started our center, we used to tell people, if you're going to take the medication, it's like caffeine, it could keep you up. People came back and said, you have no idea what you're talking about. I've never slept so well. And so what we did was we started digging into sleep and ADHD medications. And what we realized is that people fall into three groups. There is a group of people who, once they start the ADHD medicine, they're very light sleepers, and the ADHD medicine could make their sleep worse.
Mhm.
Now, they shouldn't fret about that because there's things that we can do. We can adjust the dosage, adjust when you take it, or change the medication. So if that happens, we can fix that. But that wasn't the bigger group, Andre. The biggest group were actually people who slept better. And the logic there is that a lot of times people can't sleep because the ADHD doesn't let them turn off their brain at nighttime.
Yeah.
They're still thinking about all the things they're going to do tomorrow that happened today or just random thoughts. And so when somebody can't sleep, a lot of times that's because of the ADHD. So those people, once they start the ADHD medication, they actually sleep better.
Mhm.
I've got a couple of siblings that comes to visit us from Australia once a year, and they both have ADHD. And this might sound really strange, and I've never seen people do it this way, but they take their medication right before bedtime. And I said, why are you doing that? You're wasting the effect of the medicine because you're sleeping through it. And they said, but you don't understand. Yes, we don't function so well in the daytime, but we need the medication to sleep because our brain doesn't stop working otherwise.
Correct. Yeah.
Just to tell you that, so if so a lot of people will actually sleep better with the ADHD medicine. So some people it may make their sleep worse, but we can help with adjusting the meds to fix that. But the majority of people will actually sleep better. And the third group is it won't change. So if you're a lousy sleeper before you started the ADHD medicine, you'll stay a lousy sleeper. And if you're a good sleeper before the medicine, you'll stay a good sleeper. And so there are three groups, but be optimistic for your listeners. Don't shy away from the medication because you think it might make your sleep worse. In fact, it likely will make it better.
So in a way, it's like really, it's either some people I know can have a dose of caffeine, like coffee, right before bed and sleep like a baby. Some can't sleep at all because they get too hyped up. And so I guess a lot is it's timing of the dosage and the type of dosage and that. And I never thought about it, but I've heard a lot of people say that taking coffee before bed they sleep better. And like I tell the listeners, my trick is actually I can't turn off my brain. I just need to slow it down enough so I can fall asleep. And
Yeah.
what I heard from you, sometimes that stimulant medication for a certain few that actually helps slow it down so they can fall asleep.
Yeah, and the comparison to coffee is a great one, Andre. You'll always see that couple who says, "Nope, can't have coffee, only decaf because I won't sleep for 3 days," and just sniffing the coffee will keep them awake. And then you
Yeah.
have other people that can drink 3 pots of coffee and still sleep standing up,
Well, they
right?
can't, yeah,
So,
and they can't stay awake. Like,
right,
that blows
right.
my mind.
Yeah, absolutely.
We've heard a lot about drug holidays, especially with the kids. I don't want to, okay, I got to, give the medication to my kids during the week, but on weekends, I want them to take a break. And a lot of people call those drug holidays. So, what are your thoughts on that?
Yeah, so the present recommendations are that we don't believe in drug holidays for ADHD. And the logic is this, is that, like I said, in the 70s and maybe even in the 80s, we used to think the medications or the treatments for ADHD were just for school and maybe just for work. So
Mm-hmm.
then people said, well, I only need it Monday to Friday, and I'll keep my kid off of it on Saturday and Sunday or off during summer holidays or winter holidays. But now we've realized for a while now that ADHD just doesn't affect work and school. It affects all
Yes.
parts of your life. Whose weekend is any easier? On the weekends, there's sporting activities, there's family time, there's hobbies, there's dinners out, there's homework, there's projects. So nobody's weekend these days is any easier than their weekday. So that's the first thing is from a functional perspective, you're actually doing yourself a disservice by coming off the medications. So you should continue taking them all the time. From a medical perspective, there probably isn't any danger in taking a break from the medicine once in a while. So if somebody wants to stop the medicine on a day or take a break for a week, it's not like an antidepressant, like an SSRI or an SNRI, which a lot
Hmm.
of people have been on. And the pharmacist and the family physician or nurse practitioner will tell you, don't stop this abruptly because you'll go into physical withdrawal. That doesn't happen with the ADHD medicines. So the answer is kind of twofold. From a functional perspective, do not take drug holidays because you need it to continue functioning
Mhm.
well. From a medical perspective, there probably isn't any danger in skipping a day or two if you want to, but you really shouldn't need to do that. And so there really isn't a lot of need to take a drug holiday. We would actually recommend that you continue taking it 7 days a week.
Right. And I think you got to, I'm really glad you bring up that point. So any medication related to depression, anxiety, and those you can't just cut cold turkey. And to get advice from your medical practitioner on how to wean off of it or get off. But the ADHD medication, we can do a quick stop and start.
Yeah, absolutely.
Okay.
And that's partly because it's so short acting. It only lasts
Yeah.
for the day.
And no matter what, still talk to your medical professional about medication changes. Just don't take our word for it. Always go back
That,
to your medical professionals
and
about
that's
it.
a really good point, Andre. We're holding a session for educational purposes. Never stop or start or adjust your dosage on your own. Make sure you have the guidance of your medical practitioner before you do that.
Can we deal about the biggest myth out there with medication and ADHD is will taking medication hamper my creativity?
Yeah, that's a great example. Sorry, a great question. And I've got sort of two examples come to mind. I had this young woman come to visit, and she was going to university in Ontario, and she said, I don't like to take the medicine other than during exam week because I like being my fun, creative, energetic self, the life of the room. And I said to her, well, firstly, if you took the medicine all semester, maybe that last week wouldn't be so stressful because you would have learned more stuff during the rest of the semester. But the second part was I said, maybe you need to ask your friends and family, people around you, how much fun are you actually during the rest of the time when you're not taking the medication? So creativity is interesting, and it's certainly people who are artists, writers, comedians, sculpture, photographers will say, there is something that happens in my brain that's a bit different. But here's the thing: is that even if you let's say with ADHD, and I'm just going to do hypothetically here.
Yeah.
Let's say with ADHD, you have this random insertion of ideas. You have this great, sort of free flow of ideas, what we used to call brainstorming.
Mhm.
Whereas with the ADHD medications, you're just a bit more sort of thoughtful, concrete, goal oriented. So some might say, well, are you going to lose that creativity and that free flow, all those wonderful ideas? And I would say it's possible, but what have you been able to do with those free flow of ideas if your ADHD is not well managed, right? So there's got to be something that's sort of in between, which is that if the medication is dampening your creativity, then I'm going to suggest to you your dosage is too high or you need to change the medication because it shouldn't change your personality. I would flip it around to say, well, wouldn't you want to do something with the creativity? Do you not want to write that book or create that art piece or, stand up and give a funny talk? Because that really requires attention and focus, which
Mhm.
is once the ADHD is treated. So if your creativity, or let's go for one step further, Andre, if you feel your personality changes because of your ADHD medication and you turn into what people say are like a robot, like Data on Star Trek or a zombie, well, that means that the medicine isn't right. The medicine shouldn't change your personality. It shouldn't change how you feel. It should change how you think. You should do different, not feel different, right?
Change the way you think. Is that what you said?
Yes, you shouldn't necessarily feel different or become a different person, but you should think in a different way. You should be able to collect your thoughts and be
Right.
more focused and be more productive.
Nice. I love that. Um, we got time for one last point here. And when you said this as a possibility, and it really intrigued me. You said if I don't take ADHD medication, will it give me an advance for post-secondary school? What did you mean by that?
Yeah, it's a good question. So one of the myths out there is that people think that by taking ADHD medication, let's just say Adderall or whichever, even one of the ones I've listed before, does that mean that you're going to be smarter? And people often in university or colleges or even in high school sometimes think that if they don't have ADHD and they take their roommate's Adderall, they're going to do better on that exam or they're going to do better on that term paper.
Because they
Now
can
here,
focus. They believe they can focus better.
Absolutely. So here's the thing is that a lot of studies have been done that people who do not have ADHD that take ADHD medication, it actually doesn't have the same effect.
Mhm.
Now one thing to be careful about is because it's a stimulant, it will make you more alert. So if somebody doesn't have ADHD and they take one of the ADHD medications, of course they'll feel more alert because it's a stimulant. But you could get that same level of alertness from an energy drink or coffee. Now that level of alertness might help you stay awake more, or maybe you can pull an all-nighter. And for that reason, you might do better on the exam. There was a study done that's very interesting, and I'll try to explain it fairly concisely. There was a study done where they took two groups of people. Both groups did not have ADHD. So remember, neither group has ADHD.
Mhm.
They gave one a placebo, which means there was no medication, active medicine. They gave the other group an ADHD medication. Remember, neither of these groups have ADHD.
Mhm.
Then they had both groups play computer chess. And what they found was that the people who took the medication didn't do any better than the ones who didn't take a real medication. But the ones that took the medication took longer to make a move or make a decision. You know how with the computer chess, there's a bit of a
Yeah.
timer, either
Yeah.
an hourglass or a clock. So their outcome wasn't better, but they did actually take longer to make a decision. So they ran out of time. So I wish I could get in front of, and perhaps with your the assistance of your podcast, get in front of more people, especially university and college students, and say, don't take your roommate's Adderall
Yeah.
because you're fooling yourself. It really isn't making you it isn't making you function better. You're more awake, which may make you more get more done. But there are other ways to do that, and certainly a lot of safer ways to do that without taking someone else's prescription medication.
There's a big difference between being alert and being able to focus. I think it's
Absolutely.
the key thing. So I kind of had this thought in my head. So I don't know if you want to confirm or deny it. It's fine. It's just like, to me, is if you give an ADHD brain a stimulant, everything slows down. They don't get hyper. They focus and function a little bit better. But if you give a stimulant to a non-ADHD brain, they get hyper.
I like that, and I think that's. I mean, it's probably different for a lot of different people, but I
Yeah.
think that generalization works. So people with ADHD, remember, they have a flight of ideas, and they're going in a whole bunch of different directions. And so when you're saying, Andre, that it slows them down, it's actually helping them sort of process, communicate, and not be so scrambled, right? And
Right.
to stay on task. Yeah,
Yeah, that's what I say. I got 2,000 thoughts in my head at all times, and the medication can help me narrow it down to 200, which is a
exactly.
big a big change. So, wow, this is fantastic, and I hope the listener here that I hope what Dr. Parhar provided you today gives you more clarity on ADHD medication and the myths for you to make a better informed decision, and also how to present this information to your doctor. And I think there's three great points here. We got a I really loved here. Is if you can't get to your level of functioning, then use medication. And is it a lifelong use of medication? And I loved your answer, Dr. Bahar. It was depends on the situation. It depends where you are. And the creativity dampening, if your creativity is dampened, then it's a medication dosage adjustment that's required. Because, like you said, we don't want to change the person, we just want them to change the way they think. So if you feel different, then it's a medication adjustment that's required. And there's a big difference between being alert, hyper, as I kind of say, versus focusing or being able to focus. And I love it. Dr. Pahar, thank you very much. The listener, what are your thoughts and beliefs around medication? And has this conversation helped you think about it differently? And Dr. Pahar, we can find you at Adult ADHD Center, RE. Show notes, you'll find his link. Take a look, and you got a lot of good resources. You updated your website, and it's lots of great information there. Dr. Pahar, thank you very much for your time and your expertise.
Thank you, Andre, for having me. Great talking to you about this topic.
Will do. All right. To the listener, thanks again. Talk to you soon.